for applied behavior analysis, first use electroshock therapy when treating their patients. Hi, my name's Hadley. I'm a registered behavioral technician. I'm going to get my degree in ABA and hopefully my master's after that to become a board certified behavioral analysis. So when ABA first started, it was a new science. It still is pretty new, and there were tons of procedures that we do not use now that they used then. So now a lot of clinics are coming from a nurturing approach when treating these kids with autism. So that could look like trying to help them regulate themselves with these huge emotions, identifying those emotions. I've helped with feeding therapy, occupational therapy, physical therapy, play therapy. A lot of these kids that I see are on completely different sides of the spectrum. I've helped kids look when someone says their name. I've helped kids learn Russian alphabet. I've helped kids get ready for school. I've helped kids just get ready for life. It is a little crazy if you don't know about it. The things on Google are not always correct. I do think the ABA can be done poorly. That could look like using shock procedures, not giving the kids room to have emotions, or wrongfully using punishment. But the way that I do it is solely from wanting to empower and advocate for them. The demonstration I have for today is with plants, and I've seen this thing all over social media about how if you talk to a plant, it grows better. You give it praise, it grows better. Hey buddy, I know that's really hard, but you're so strong and you can do it, helps it grow better. And that's what ABA is here for. We want to help these kids grow and become the best them that they can be. That does not mean that we don't want them to STEM. I encourage STEMing. There's a few kids that like to wave their hands in front of their face, and sometimes they'll grab my hand and want me to wave mine as well. It's really amazing. So I have some water, and to demonstrate, act like this is a kiddo. Obviously I can't have one, HIPAA, but so he is having a really hard day. His friend wouldn't share with him, and he's just really upset. Might be throwing himself on the floor, he might be doing whatever, he's pretty upset. So I give him some space, so that gives him a little bit of independence. Like, if he wants me around, that's awesome, but he doesn't need me. Like, he is fully independent on his own. But then he kind of reaches for me. So I give him my attention. I ask him what's wrong and how I can support him. That might look like rubbing his legs or giving him squeezes to help regulate his whole system. That might look like getting a chart so he can help identify how he's feeling. And then when he does identify those feelings, we can go from then and figure out what we can do. I just think it's really important that we realize that the things that I personally do for these kids is to help them grow. I do think that if it is done wrong, it could end up looking like this kiddo. And there are procedures such as, the electroshock that I've talked about before, or taking stuff away when they're upset. That doesn't help the situation. They're just upset. You know what? Well, you're at recess today, you pushed someone, so we're not going to leave your room for an hour. How is that equivalent to anything that just happened outside of recess? For these kids, we want them to be the best them so they can be, and it's really important that we're